Okay, video 2. So you might be wondering, how can something like this happen? How does this happen? And it might sound a little bit woo-woo, for lack of a better word, about meridians and how that could affect something in our mouth, could affect something else over here in our body. But I'm telling you, I just went through and compared my specific teeth to the issues with the meridians and took notes, and it is like verbatim to the issues that I have. So I'm like a living testimony here, and it's really hard to believe and accept, actually. Like, I keep getting more evidence that this is what's going on for me, and I'm still like, is this true? Is it going to help? So I'm with you. And yet I have all this literature here that I want to share with you just a little bit. I went through and highlighted some of the specific parts that I feel like are really helpful and educational, and can help you see how this is going to help me and how it might be able to help you or someone you love. So when those wisdom teeth are extracted, or also we'll learn after a root canal is done, these are the two most common procedures that cause this. A cavitation happens. So this says cavitations are a disease of the bone characterized by a degeneration and death of the marrow and bone from a decrease in bone marrow blood flow, either slow or abrupt. This condition is accentuated by dental infections and are also caused by improperly removed teeth, where the periodontal ligament, PDL, is not removed following extraction and root canaled teeth. So part of our teeth, they have, like, I learned they have this entire pocket, almost like a placenta for each tooth, and all its amazing dentine tubules, like thousands of miles of tubules per tooth, by the way. They have all this stuff like in there. And when they do a root canal or remove wisdom teeth, the traditional outdated dental model is to simply remove the tooth or do what the root canal procedure is, which I can share more about too. But all the other parts associated with the tooth are left in there to decay and rot inside of the body. And no other procedure or process is dead tissue left in the body than these processes. So this part was really like connected to me and my story. It says that this ischemic osteonecrosis, which is a word for the decay and everything happening there, most often affects the hips, maxillofacial bones, and knees. Well, guys, I have significant hip and some knee issues, but very significant hip issues, and have for years. When I go to the chiropractor, my legs are like 1 inch off and my hips are twisted. And I have gone to like 7 different chiropractors, done multiple appointments in a row, spent thousands of dollars trying to address this issue, and nothing has ever gotten to like the underlying root issue of resolving that imbalance that I'm having. And so I'm thinking even that is connected to this. Okay, nothing highlighted there. People are shocked to learn that most root-filled teeth need to be extracted, and shocked again to learn that when tooth removal proves necessary, just pulling the tooth is not enough. During the early 1950s, some European physicians and dentists reported the sockets of numbers of old tooth extraction sites had not filled in completely, thereby leaving thin holes in the bones of the jaw, and at times larger areas. These cavitations result when the periodontal ligament, the tough fibrous tissue that holds the root of a tooth to its bony socket, fails to break down and disappear during the healing process. Thus, as the socket heals and fills in with new bone, this thin strip of fibrous tissue prevents the growth of new bone in that area, causing a narrow space to remain. whatever bacteria and toxins were trapped in the periodontal membrane remain in the jaw as a chronic infection. Studies have shown these cavitation areas are infected with 20 to 30 species of bacteria. Chronic osteomyelitis is the most frequently found infection. Osteomyelitis is a serious infection of bones. It is usually caused by Staphylococcus bacteria and sometimes by Streptococcus and other organisms. This one doctor who was doing the procedures, one of the very early ones, found a high percentage of such patients were cured when their root-filled teeth and or cavitations were removed. So a surgery where we go in and extract all the stuff that was left behind 24 years ago, in my case. The periodontal ligament, and as you'll learn, a millimeter of the bone needs to be extracted that's infected. It's a lot. There's no question that the tissue removed is abnormal. It is described as gritty, sawdust-like, hollow cavity that contains small clips or flakes of dead bone. They tend to be dry, but some bleed and others are filled with a watery fluid. This doctor and his group reported on 103 cases in 1991, of which 34 were trigeminal neuralgia patients, which is the most painful disease that anyone can have. They've done studies. They found by surgically eliminating these areas in the jaws, doing the cavitations of the work that I'm looking for, 73% had total relief on all their other symptoms and things that they were having, and 16% moderate relief, and that the patients were satisfied with the program. And I'm sorry, that covered the trigeminal, the ones who were actually having jaw pain, but others who were suffering from chronic degenerative diseases of the kidneys, the liver, the stomach, the eyes, the brain, migraine headaches, sinus infections, etc., they also saw improvements, but they didn't have as many of those cases because no one's going to their dentist to get that procedure because they're not making the correlation. They're going to all the other specialists, okay? There's a story of like a woman and her specific headaches and symptoms, stomach upsets. After the surgical treatment of 3 of her previously extracted wisdom tooth areas, she was immediately free of all of her illnesses and pain. And then the next one is like the next day after his surgery, he could walk without the pain that he'd had in his knee for 20 years and things like that. There's countless ones of them. The only known successful treatment of cavitations is their surgical removal. The oral surgeon makes an incision in the gum and exposes the infection site. The cavitational area can be a small area or a rather large hole. Sample tissue biopsies taken from these areas disclose the presence of the infection. So they take a biopsy, and they've done tons of them and sent off for evidence, and that comes back where they're fully infected. The abnormal bone is meticulously cut away. Sometimes the infection areas take strange pathways that undermine the normal bone. Such good bone must be removed in order to eliminate all that is infected. This means that in order to prevent the formation of these disease areas when infected teeth are extracted, it is prudent for the dentist to remove the periodontal ligament and 1 millimeter of the bony socket. Very little, you guys, you probably haven't heard about this, and your dentist may not even heard about this because, as we know, research has been suppressed on things that actually help humanity heal. So it just goes on to say that very little is known about the subject of cavitations by the average dentist and physician, but because these infections cause so many chronic degenerative illnesses, healthcare professionals are beginning to take notice, and you guys can be the ones to take it to your dentist and start asking questions, or look for a biological dentist that specializes in this, like what I've found. Okay, so that's like the extent of the procedure. There's a little bit more about what else this can cause, specifically the wisdom teeth cavitations that I had. They're on the heart meridian. So this one is really common. A lot of people have these removed, and that's on the heart meridian. And here it says, the study showed that having root canal treated teeth in your mouth increased your chances of having a heart attack. The article did not specify that the root canal treated teeth were successful or not successful procedures following standard endodontic follow-up guidelines. It merely specified that the risk of heart attack increased considerably due to the presence of the root canal treated teeth in the mouth. So if you have one, you know, this is something that you could be at risk of. It's very clear cut. This is where I did all my taking notes from the different charts I got with the different meridians. And so I have my 4 wisdom teeth sites, but then I have these 2 next to this one, which has been the really, really problematic area, which are on 2 different meridians. So these 2 are the large intestine and the lung, which at some point after that time when I had the procedure done, I began getting chronic bronchitis, and that is listed for this meridian. And I hadn't had that problem before. The knee, the hand, the foot, large intestine, I think I mentioned, the bowel changes and different things I was getting tested for. Pituitary, central nervous system, and psyche. I have definitely had some nervous system going on. I mean, I also attribute that to like my own unhealed trauma, but I'm addressing that and taking lots and lots of deep dives and actions to address that. So I'm coming at it from multiple angles, but it's really interesting to see it show up here as well. Hip, knee, bladder. Okay, I have significant bladder stuff and pelvic floor stuff, and those teeth happen to be in the front here. But guess what else can affect our meridians and the organs on them? Metal in the mouth. We're not meant to have metals in our mouth. So I have this awesome permanent retainer that I've had since I was about 14 when I got my braces off, that runs all across the bladder meridians and organ. So that makes sense to me. I could go on. Joint pain, very significant joint pain, feeling tired, sometimes bouts of depression, trouble concentrating, increased thirst and need to urinate. That's the one that I have. There's just so much here. I don't want to just keep going, but so I did that work. I correlated it, right? Then they do several tests at the dentist. This is what I just got back from yesterday. So I'm going to start another video for this.